Hello, everyone. I would like to begin by respectfully acknowledging that the land on which I live and work is the unceded territory of Coast Salish peoples, including territories of the Musqueam and Tsleil-Waututh nations. A little bit about myself. My name is Sepi Sarbazi. I am a dietitian registered with College of Health and Care Professionals in BC. Throughout the past several years, I have actually held various jobs in the Lower Mainland before I found my professional passion in the job that I'm currently holding as a home health dietitian. My practice has now been increasingly becoming focused on home tube feeding, cancer, and neuromuscular conditions. But how I became interested in the ketogenic diet was by encountering patients' growing interest in the ketogenic diet therapy that prompted me to pursue some further education in this field, including some training through the Canadian Nutrition Society on ketogenic diet therapy. And as I continue to observe the expanding relevance and popularity of ketogenic diet approaches to various health conditions, I would like to remain engaged and passionate learning and teaching in this evolving field. And my hope today is to provide you with some evidence-based and reliable knowledge here. I also would like to declare no conflict of interest, no involvement in researches with focus on this subject, or involvement with manufacturers and suppliers of any products that could be mentioned during today's presentation. And with saying that, let's jump into our today's talk. So to begin with, seizures are quite different than epilepsy definition. Seizures are quite common and they can happen due to a variety of causes such as tumors, stroke, and etc. However, epilepsy has a distinct definition. The definition of epilepsy is the recurrent, unprovoked seizure, and only a very small percentage of population is affected by that. Today, we know with no doubt that medication is the most effective treatment for epilepsy. They started in 1920s with first generation of medications, and then there were second generations, and now we are into third generations of medications. And most studies indicate that majority of patients, above 60% of patients, can get optimal epilepsy management on the correct regimen of anti-epileptic medications. Although we have all these new medications that we've developed, we still have up to a third of the individuals with epilepsy being resistant to medications or having what is categorized as refractory epilepsy. By definition, patients who have had no response to two or more number of medications for the treatment duration that was determined by a physician are known as having refractory epilepsy. Refractory epilepsy could severely impact lives by causing frequent seizures, leading to physical injuries, cognitive decline, psychological issues, social stigma, and reduced employment and education opportunities, driving restrictions, and of course, significantly increased mortality risks. So we recognize that we need other alternative therapies for these patients. In this slide, you see a variety of modern alternate approaches to managing epilepsy, and ketogenic diet is, of course, among them. There are also a number of patients with medication-controlled seizure who pursue this alternative therapies when the adverse side effects of anti-epileptic drugs actually significantly impact their lives. So, is there a role for diet making seizures improve? Well, this is basically what we are discussing today. So the word ketogenic means producing ketones. It is a medically supervised high-fat diet that is low in carbohydrate and protein sufficient, that is designed to basically put body in a metabolic state similar to fasting, that is used for the epilepsy and a lot of other health conditions. There are now a lot of interest and researchers actually looking at the benefits of a ketogenic diet for weight loss, type 2 diabetes, some metabolic syndromes, obesity, neurological conditions like ALS, Parkinson, Alzheimer's, MS, and definitely some sorts of cancer. So basically, we always want to talk to our patients about what kind of diet ketogenic diet is not. Ketogenic diet is what we call a non-pharmacological therapy for treatment of medication-resistant epilepsy. But I want to stress that in no way it is natural. This is not a diet that is without its possible risks or side effects, especially with all the YouTube generations and countless body of information and resources that are available online. We need to be careful about what is that we are trying to achieve and what is it that we are not. It is also not to be confused with other diets that actually deliver benefits for other situations like gluten-free or South Beach diet. They're also low carbohydrate diets, but ketogenic diet is different, and persons with epilepsy do not benefit from other types of diet that are just low in carbohydrate. Ketogenic diet has been used since the early 1920s, and when you read the old medical texts, you might not come across the name ketogenic, but in old medical journals, they talked about, bringing people into hospital and not giving them anything to eat for 5 days, so basically fasting them, and their seizure would go away and get better. And so also, even though we've been using it medically since 1920s, if you go back into old papers, it's been used since the year 500 BC, and basically we have just modernized it and expedited the benefits. So to understand how different a ketogenic diet is from a typical diet, we need to have a simple understanding of macronutrients our diet is consisted of, which include carbohydrates, proteins, and fats. Carbohydrates are sugars, starches, and fiber that provide body's main source of energy by converting into glucose, also known as blood sugar, which is stored or immediately used for fueling your brain, muscles, and other organs. Carbohydrates are found in grain products like bread, pasta, rice, as well as fruits, vegetables, and dairy, and many other foods. When speaking about carbohydrates in keto diet or any other diet that monitors intake of carbohydrate, what we really refer to is the net carbohydrate or the absorbed carbohydrate that actually impacts the blood sugar levels. This refers to the total carbohydrate content of the food minus the fiber and the artificial sweeteners, because these are not absorbed and not counted as grams of carbohydrate that impacts the blood sugar. The next group of macronutrients are protein foods. That would include things like meat, poultry, seafood, soy products like tofu, legumes, and eggs. And fats include oil, butter, margarine, heavy cream, and nuts. There are many foods that are a combination of more than one food group. So for example, nuts may be high in fat, but they're also really great sources of protein, or dairy products being a source of all the three macronutrients. Generally, in an average standard Western diet, more than 50% of daily energy is obtained from carbohydrates, about 30% of calories coming from fats, and 15% of the energy is derived from the protein sources. So how really the ketogenic diet works is, putting it in simple words, in a regular diet, sugars or glucose is the main source of energy for many organs. In absence of carbohydrates, liver breaks fats into compounds called ketones that become the primary source of energy for brain and other organs. And this improves energy efficiency and alters cellular signals. Basically, this mimics the metabolic state of starvation and forces the body to utilize fat as primary source of energy and puts body in a metabolic state that is called ketosis. How differently body functions when ketones are used as primary source of energy plays a positive role in different states of metabolic function, such as reducing inflammation, controlling the level of brain chemicals, and other complex processes that we are not getting into in here. As we mentioned, in an average standard Western diet, more than 50% of daily energy is obtained from carbohydrates, 30% is coming from fats, and about 15% of energy is derived from proteins. A ketogenic diet basically changes these ratio in a significant manner. A classic ketogenic diet is based on a ratio of grams of fat to grams of carbohydrate and protein. So, for example, a 4:1 ratio diet offers 4 grams of fat for every 1 gram of protein and carbohydrates. And of course, for an accurate follow-through, all of the foods in these diets are weighed on a grams scale. When we look at how a classical ketogenic diet compares to a typical diet, at a 4:1 ratio, basically 90% of the calories is coming from fat, and only 4%, about 3 to 5% is coming from carbohydrate. Whereas in a typical diet, in that colorful wheel, more than half of our diet calories are coming from carbohydrates. The 3 to 5% carbohydrate allowed is as little as 5 to 6 grams of carbohydrates for the entire day. And just to give you an idea, knowing one slice of bread is about just 15 grams of carbohydrate, we could understand how restrictive of carbohydrates is a classical keto diet to deliver the clinical benefits. However, the classic ketogenic diet is very restrictive. It mimics fasting, but as you can guess, the big disadvantage is that it's very difficult to follow for long term due to strictness. As the time went by, more variations of the ketogenic diet were introduced that you might have read or heard about. Basically, they're playing with this ratio and modifying that anywhere between 3 to 1 to 1 to 1 to make it more practical. One of the most famous variations is MCT diet, using MCT or medium chain triglyceride oils that are commercially sold. This allows for more carbohydrate and definitely more proteins than a classic keto diet. The advantages are that it is basically less restrictive than classic keto diet and delivers a similar efficacy to a classic diet. And the disadvantage could be that using MCT oil could cause some gastrointestinal issues like diarrhea. The next famous diet is modified Atkins diet. It is also less restrictive, allows a tiny bit more higher carbohydrates in the beginning, as high as like 20 grams a day, and it definitely allows for more protein inclusion in the diet. The advantages of this diet is that is very comparable in many studies in its seizure reducing effect, and the better tolerability and easier to adhere to for the patient is definitely of the advantages. And finally, the least restrictive diet that is known to deliver some ketogenic benefits is the low glycemic index diet. That is the most generous variation. Generally, as observed, moving from a classic keto towards a low glycemic index diet, the restrictions are basically easing off, and so basically they are becoming more practical for patients to keep consistent and adhere to the diet. The original medical ketogenic diet was developed in 1921 by Dr. Russell Weidler at the Mayo Clinic, specifically as a treatment for pediatric epilepsy. So it makes sense that throughout the years, the majority of researches and studies have been focused on children. One of these mostly referred to studies is the one that you're observing here at the left. It's a study on the short and long-term efficacy, safety, and tolerability of the ketogenic diet. So this study observed that onset of seizure improvement was only 14 days after starting the diet for classic keto diet and 10 days after starting an Atkins diet. It was also observed that there was a significant decrease in the seizure severity by 100% change from their baseline after 6 months in the classic keto diet, and the same efficacy in the other group, the modified Atkins group. Seizure frequency after 3 and 6 months of starting the keto diet showed a significant decrease. And then 6 months after initiation of the diet, almost 60% of the classic keto diet and almost 50% of the Atkins diet patients were seizure-free, and the rest who were not seizure-free had at least more than 50% seizure reduction. Also, this study found that patients who tended to have less ketosis state, basically not in perfect compliance with the diet due to any reason, obtained no benefit as compared to those who were controlled and always had ketosis state and in perfect compliance. But ketogenic diet is not only for children. Looking at some comprehensive reviews of the efficacy studies that reviewed the classic keto diet studies and modified and Atkins diets in adults concluded very promising outcomes. As you see, the classic ketogenic diet has had a high efficacy as high as 30% in adults, although it was higher, about 50 or 60% in children. However, looking at the benefits of less restrictive versions of the diet, as modified keto diet or modified Atkins diet benefits among the adults, it was observed that the number of adults with significant improvement, meaning the adults who had 90% improvements or basically became seizure-free, were actually higher than the ones who tried the restrictive classic keto diet. And this was probably attributed to a likely much better compliance in the diets that were less restrictive compared to a classic keto diet where patients actually saw better outcomes. So in summary, a comprehensive review of many of these studies make consistent suggestions of which variation of keto diet works best for each age category. For children younger than age 2 with epilepsy, the classic ketogenic diet is often considered the gold standard for efficacy, mainly because I think this age group could be easily kept on ketogenic diet adherence because their intake is mostly including ketogenic formulas and they're not much of food eating age. And modified Atkins diets and MCD diets are also considered excellent alternatives, highly effective. In many studies, they have seen the same seizure-reducing effects and more flexible, so offering easier adherence and cause potentially fewer side effects. After all, similar to all other alternative therapies that are designed for each individual, taking into consideration individual clinical, environmental, and other factors are very important to guarantee the best success. So ketogenic diet sounds promising, but what are the side effects of the ketogenic diet therapy for epilepsy? Basically, there are some common side effects, and then there are some more specific and some rare side effects. Here you see a list of the side effects here, but ultimately the side effects that you see here and are discussed in the textbooks and references can be seen in both modified and classic generic keto diet. The most common side effects are constipation and then some weight loss. Occasionally there is some acid reflux or upset stomach. There's occasionally dehydration and some metabolic acidosis, which are mostly seen in children population. At times, osteopenia, low bone density, and risk of bone fracture is a long-term effect of it that could occur, but then this is also known as an adverse side effect of anti-epileptic medications. Essentially, these are the main reasons a patient must be coached and monitored by a dietitian and other healthcare providers as needed to monitor and assist with minimizing, managing, and treating these side effects. So when it comes to benefits versus harms at times, we can draw a clear line between who absolutely should and who absolutely should not try this diet, and the rest actually fall in between these two lines. Among the patients whose seizure is not fully controlled on medication, the ones who should absolutely take a chance on this diet are people with metabolic or neurological conditions that has basically anything to do with impaired carbohydrate metabolism, and people who have sufficient motivation and family support and capacity of mental and physical capacity and ability to comply with the diet are absolutely great candidates for trying the diet. On the contrary, patients with well-controlled seizure and medications, or patients not diagnosed per definition with refractory epilepsy, do not really benefit from these restrictive diets. Aside from that, there are certain red line exclusive criteria where basically forbids some patients to try this diet regardless of having a diagnosis for refractory epilepsy. This includes patients with certain metabolic diseases that impairs absorption or metabolism of fat in the body, type 1 diabetes patients who are on insulin, of course, patients with acute or chronic pancreatitis, liver failure, patients with gallbladder diseases and history of gallbladder stones, patients with certain kidney issues, including recurrent kidney stones or more advanced stages of renal failure are not safe candidates for this diet. And persons who are pregnant or breastfeeding are also very much encouraged to not try the more strict and restrictive variations of the diet. So when reviewing and interviewing a patient for appropriateness of the ketogenic diet trial, we keep in mind how to practically implement the diet and explore challenges and barriers and possibilities to identify the most suitable ketogenic diet initiation method. We consider a lot of variables. We consider family, community resources, ketogenic diet care team, as well as the hospital resources and ketogenic diet candidate themselves. The candidates are advised that they might have to take time away from school or work because of the initiation processes are going to be abrupt lifestyle changes. We look at the medical acuity, of course, the ability to accommodate coming into hospital or adapt to the new food preparation abilities and skills. Another factor is looking at their family who needs to support the candidate, potential changes in their family dynamics to cope with the new eating style, as well as equipment affordability, food affordability. We also make sure there's practical support in the community for the candidate to be able to offer cooking demonstrations, connecting them with support groups or any web-based tool, as well as looking at if the family might need to support the local community, school or workplace, making sure there is access to outpatient labs in case you need to monitor side effects, as well as we make sure that you have a properly trained ketogenic dietitian and a ketogenic care support team familiar with monitoring and managing the side effects. And we look at the hospital resources, possible costs, and basically circumstances that might impact the person's life if they are having to be admitted to hospital for the initiation process. So as you heard how many variables have to be kept in the perspective for initiating, supporting a patient. All these variables in the picture is basically telling us why you need to do a proper assessment at the beginning to figure out which kind of diet that you begin in having a multidisciplinary healthcare team when considering keto diet therapy for epilepsy control. And ideally, in a multidisciplinary healthcare team is consisted of physicians and clinicians who are experts in working with epilepsy patients, dietitians, nurses, pharmacists, behavioral health counselors, and social workers, and a full team that actually is trained for dealing with the changes that the person is going to go through. So the most common and safest environment, especially for children, is inpatient admission to start a trial of the ketogenic diet. At this time, per my knowledge, BC Children's Hospital is the only hospital in BC offering a specialized ketogenic diet support team for children and provides services to them. And children are admitted as inpatient anywhere between 3 to 5 days to be started on a keto diet. However, there are also some adults where we consider the safest option for them to start a ketogenic diet would be a hospital inpatient status. And these are mostly adults who are medically unstable or where the immediate resources are needed to manage acute side effects because in case of these adults, we traditionally need a rapid titration of nutrients to introduce the diet and transitioning the patient to a ketosis state as soon as possible. So those adults also getting admitted to go through the rapid titration. And I'm going to talk about the rapid versus slow titration in my future slides. Outpatient care environments such as clinics, in-person, face-to-face education, or virtual services is probably the best for those who cannot reach hospital setting or where there is no better availability and of course the patient is medically stable. The advantages of beginning to learn and implement the diet in outpatient setting is that patients actually start this using their food from their own home and community, and they could be coached for both rapid and a slow titration to achieve the proper ketosis state. At this time, the only outpatient program that I am aware of that is offering dietetic consult to adults with epilepsy for ketogenic diet is a newer program, a newer neurology clinic in Gordon and Leslie Family Diamond Center in VGH. Basically, this is an outpatient clinic that is supporting patients who would most likely require surgical interventions for their epilepsy, and there are dietitians who actually optimize these patients to basically getting into the surgery point. And among the services that they are offering is the ketogenic diet transitions and consults. So it is a very specialized clinic, and unfortunately it's not open to every person with epilepsy, but people who actually, you could always ask your GP or neurologist to see if you are an appropriate candidate for referral to this clinic. So to give you an idea of how a 3 days admission in Children's Hospital for children to initiate keto diet would look like, it's an intense 3 days. They start day one. Basically, they start the ketogenic diet after 6 to 8 hours of fasting, and after the baseline blood work is done. The parents' education starts on the same day. The medications are left unchanged, and they're starting with this pre-designed diets that Children's Hospital has already in design, with all the accurately counted calories, grams of fat and proteins, and that a certain child at a certain age should take. So through the evaluation and interviews on that day, they modify these standard diets to customize it for each child's certain activity level, growth needs, and other clinical condition that might be impacting their nutritional needs. And at the end of the day, they actually have this prepared individual prescribed diet, and no two-person really end up having the same default design diet. So on second day, the parents' education continues. Children are basically transitioned to a diet that is mostly solid and provides the full caloric needs of their day. Basically parents are starting to be trained on that specifically prescribed diet that is designed for their child, how to weigh the food, how to prepare, food preparation methods, how to follow the recipes, how to actually make necessary urgent modifications. And then on day three, they start more of a hands-on checking the ketones, mostly urinary ketones, and interpreting that, and all of the remainder of their questions are answered. The child continues on their full caloric need for the day diet, and eventually all of their appointments, follow-ups, and handouts and guidelines are provided to them so that they're well facilitated with resources, and also knowing their support persons once they arrive home. So this mentioned support and resources that parents are sent home with are generally including some dietary fundamentals, the ratio, so that if they are actually in different situation, they can still hold consistent with that ketogenic ratio that they're supposed to follow, ketone monitoring, how to take diary, the supplements that they might be actually choose to start giving, managing the medication, and managing the side effects if they're milder and they can manage it on their own, and basically planning the meals and coming up gradually coming up with developing their own homemade standard recipes that are compliant with the keto diet order. In previous slides, we briefly mentioned rapid versus slow initiation methods that we're going to talk about here. With the rapid titration, you immediately drop your net carbohydrates to under 50 grams per day, and just follow this pace until you're basically hitting the 20 grams from day one. It reaches nutritional ketosis rapidly, usually within 2 to 4 days, and significantly shortens the initial sluggish transition phase. The biggest con would be the sudden drop in blood sugar that often triggers symptoms we know as keto flu, such as light headaches, fatigue, irritability, and all of these associated symptoms with low blood sugar as your body is scrambling to switch between the fuel sources. The slow titration is However, when you reduce your carbohydrate intake in steps over 1 to 2 weeks, for example, you cutting out sugary snacks first, then starchy vegetable, then the whole grains, until you reach your targets for daily carbohydrate limit. This method of initiation minimizes the severity of those keto flu symptoms. However, and it also reduces the cravings or shock to your digestive system. However, the disadvantage is it actually achieves the seizure control a little bit later. With the rapid method mostly is the selected method when there is a medical urgency, or it's basically the preferred method also with the families that can actually adapt quickly to the transition. The standard tests that are used for monitoring the patients after the initiation stage are there are a couple of tests, including the blood sugar checks that are done daily for a few days after the initiation of the diet, either in hospital or in home environment, to make sure the blood sugar levels are not dropping to dangerously low levels. And if there are no concerns, this is discontinued after a few days. The more important and long-term test that needs to be checked for the maintenance of the diet and basically assures compliance with the diet to maintain the ketosis state is checking the ketones. The most accurate method performed at home uses a digital meter and a finger prick blood sample, similar to a blood sugar monitoring machine. Blood testing reflects your current circulating ketone levels and is the most accurate method. The other method would be urine ketone tests, the most affordable and convenient method that uses dip and read reagent strips, where you compare the color change to a chart that reflects your ketone levels from a few hours ago. And last and least conventionally used at home environment are checking the breath ketones that uses a handheld breathalyzer used to monitor dietary ketosis. The follow-up procedure that we mentioned that is set up and scheduled for the patients upon discharge from hospital or after the education is complete involves a standard every 3 to 6 month comprehensive follow-up with the ketogenic diet team, which reviews the weight, comprehensive blood work, changes in their epilepsy patterns, side effects, diet compliance, and a wholesome basically review is done. Patients with refractory epilepsy should try the ketogenic diet for at least 3 months to determine its effectiveness, and if basically no meaningful benefits are determined by the doctor, after 3 months the patient is advised to discontinue the diet. But if it's successful, it is typically maintained for 2 to 3 years. The diet should never be stopped abruptly, as this can trigger worsening of the seizures. Doctor usually taper the diet slowly over 4 to 6 months by gradually increasing the carbohydrate and reducing the fat ratio in a very safe manner. What about the supplementation? We, of course, do provide personalized guidance based on patients' specific health needs, potential nutrient efficiencies, and any existing medical conditions or medications that they may be taking. We really try to use vitamin and mineral supplements that are not really specific to keto population, and mainly what is available and accessible in their local area, and of course what is safe and appropriate for the patient's age. Nowadays, the most keto education programs do use ketogenic formulas that are designed for specifically ketogenic diet therapy for epilepsy. And there are also many commercial products out there marked as keto supplement, but as dietitians, we really need to review and determine to see if they are safe to use and whether they could be actually used and blended into the prescription of the ketogenic diet that the person is following. Many of these products are, of course, claimed to be designed for therapeutic ketogenic diets, especially for epilepsy management, by providing consistent ratios of fat, protein, and carbohydrates. And some other actually also contain ready-to-use ketone products. The concern with validity and benefit of these products are mostly that the evidence evidence comes from animal studies, and there are no large-scale human clinical trials that demonstrated the benefit. And we also, with the formulas that offer ready-to-use ketones, we need to be vigilant about these supplements, as they are containing readily available ketones, and of course your ketone levels could be tested positive and within the range, but we would want to worry about basically whether giving someone a ready-to-use ketone deliver the same benefits of compared to when we actually put someone's body in this starvation and transitioning towards ketosis in a natural manner. So there is technology out there to support the patients and family to keep track of their accuracy of staying on ketosis, and also some flexibility while practicing the diet. The best and most accurate Canadian database for keto tracking is a chronometer that's used for precise, verified macronutrient data. This platform correctly accounts for the subtraction of dietary fiber to calculate accurate net carbohydrate for ketosis. There is also one of the best actually Canadian food database that's going to be available soon for ketogenic diet recipe balancing is called Keto Suite, and it will be free to use for clinicians and families to be able to balance their recipes instantly and allow for more sustainability and practicality for their ketogenic diet while assuring them that they're staying compliant with the ketosis. Because of its unconventional macronutrient breakdown, ketogenic diet has always attracted many misconceptions, especially there could be a lot of doubts and uncertainty among the patients or the parents of the children who are hoping to trial a medical ketogenic diet for seizure management. Some of these misconceptions are that ketogenic diet is the same as other popular weight loss fad diets, or that any generally low carbohydrate diet works for epilepsy, which is not true. As we learned earlier, the medical ketogenic diet is much stricter than a standard low carb diet. While all of these diets actually limit carbohydrates, the medical keto diet requires exactly prescribed fat to protein and carbohydrate ratios and targets specific ketone levels. The second misconception is that the ketogenic diet therapy for epilepsy only works for children, which is absolutely not true. It works for individuals of all ages. And while most commonly used for children, dietary therapies are highly effective for adolescents and adults as well when it comes to medical keto diet. The third myth would be patients who have tried and quit ketogenic diet once should not be going back on it, or they're not going to see any effect in managing their epilepsy because they have done their round of 1 to 3 years of keto diet practice. This also is not true. Patients can absolutely restart the ketogenic diet for seizures after quitting, and it can be a highly effective strategy if a seizure recurs. The other concern among parents would be that if they trial their children on ketogenic diet, it could cause weight gain and obesity because it's a high-fat diet, which is not true. The ketogenic diet used to treat seizures in children does not cause obesity, and in fact, it typically prevents the weight gain. Another misconception is that keto diet gives you a green light to eat unlimited bacon and butter. Absolutely not true, which basically while the diet is high in fat, the quality still matters. A well-formulated keto diet emphasizes on healthy, hard, unsaturated fats like avocado, olive oil, nuts, rather than just exclusively unsaturated fats and processed food like bacon and butter. A very common actually misconception is that you cannot eat fruits or vegetables while on keto diet. It is not true. You do need to eat your produce to get essential vitamins and antioxidants and avoid constipation, and also it is good to know that leafy green vegetables, berries, and low-carb vegetables are staples of a healthy keto diet, and are very much fitting into the diet. And I've also heard sometimes people think the blood sugar levels actually are going to be very low, so your brain stops functioning. That is not true. Basically, on a keto diet, the blood sugar levels remain stable rather than fluctuating, but it's not going down to zero, of course. And basically the blood sugars are more stable because your organs like such as liver produce glucose that body needs through the other procedures, and furthermore your brain and body can effectively burn ketones for energy, so this is not a valid concern. And the last word is the ketogenic diet is a truly life-changing, medically proven therapy that transforms how the brain functions, offering incredible hope for those navigating refractory epilepsy. By shifting the body into a state of nutritional ketosis, this dietary approach provides the brain with an alternative, highly efficient energy source that naturally stabilizes the neuron's activity and drastically reduces seizure frequency. It is not merely a dietary change, but a powerful evidence-supported strategy that empowers individuals to reclaim their focus, independence, and quality of life. And that brings us to the end of our presentation today. Thank you for joining us today and investing your time in this educational session. We hope the information shared here has been valuable, practical, and inspiring, and we look forward to welcoming you again in future learning opportunities.